Hello everyone, my name is Clara and today we're going to be talking about neurofibromatosis. So what is it? Neurofibromatosis is a group of genetic disorders that cause tumors to form in the nerve tissue, and these tumors can develop anywhere in the nervous system, including the brain, the spinal cord, and the nerves. So let's go back to anatomy. Here we have two pictures. These are nerves, and these are like cables that carry electrical impulses between your brain and the rest of your body, and these impulses allows you to feel sensations and to also move your muscles, and they also maintain autonomic functions like breathing, sweating, or digesting food. And the nerve cells are also called neurons, and that's why we have this picture in here. Okay, so let's move. Here we also have a picture of the human nervous system. So the sympathetic system, the sympathetic nerves, controls the fight or flight responses. In other words, the system prepares the body for strenuous physical activity. So the things that are likely to happen when you expect to happen, to like fight or flight. And then we have the parasympathetic nerves and parasympathetic system that regulates the rest and digest functions. So now that we understand this, we're going to move back to neurofibromatosis. So this is a disclosure because there are some sensitive images. There are three types of neurofibromatosis: neurofibromatosis type 1, neurofibromatosis type 2, and schwannomatosis. Neurofibromatosis 1 is usually diagnosed in childhood, meanwhile neurofibromatosis type 2 and schwannomatosis is diagnosed in early adulthood, most of the time before 10 years old. The tumors in these disorders are usually benign, which means that they're not cancerous, but sometimes they can become cancerous or malignant. Some of the symptoms and most of the symptoms are often mild. However, there are many complications that can include hearing loss, learning impairment, cardiovascular problems, and loss of vision, as well as severe pain. The treatment for this condition varies, and it's based on encouraging the healthy growth of children or any people that may be under this disorder. And when neurofibromatosis causes large tumors to grow that are pressing on nerves and causing too many other symptoms, surgery is preferable and it will alleviate the individual. And there is also treatment by drugs, there is also treatment by radiation, but there is no cure to this disorder and to any type of the genetic condition. So now I want you to meet Maurice. Maurice and his friend, they both have neurofibromatosis, and there is a documentary on YouTube that just shows how they have carried their lives. And I just love the documentary, and I encourage you to watch it. And I'm just gonna play for you just a little part so you can get interest and just keep watching the rest by yourself. So let's get into it. So here I have the YouTube video that we're gonna play.
Maurice Simpson has lived his whole life with massive tumors covering the right side of his face.
Why me? Why do I have to look like this?
Specialist Dr. Jason Hunt believes he can remove the tumors and rebuild Maurice's face.
Maurice is the most severe case of all the patients I take care of.
Reggie Bibbs also has tumors on his leg and face. Terrible childhood experiences have shaped his life.
People would just scream and run in fear.
Now Maurice is going on an incredible journey that will take him from the birth of a new son to a life-changing friendship with Reggie and a whole new face.
We're gonna cut away the bandages and take a look at things.
But will he finally get the face he's always wanted?
Okay, we're gonna leave it right there, and I'm just I'm gonna encourage you again to go watch it and to go see how they are so courageous and how they keep going with their lives. And I feel they're just an example to just how you can contribute to society. And thanks for watching, and see you next time.